Welcome to Aging on the Suncoast. I'm your host, Jason Martino. The caregiving role in the senior population is generally pictured as a spouse taking care of a spouse, or an adult son or daughter taking care of parents. However, a fast-growing segment of society has altered this picture. Children are often displaced from custodial parents due to a variety of reasons. Upon that displacement, these children are sometimes put under the care of a grandparent or older relative. When this occurs, caregiving responsibilities become both complex and hard to manage. On today's show, we've invited Larry Cooper, the Executive Vice President of Innovation with the Children's Home Network. Larry and I are going to explore the complexities of grandparents or other relative caregivers raising children and then discuss all of the resources that they have available. So, Larry, welcome back to Aging on the Suncoast. We haven't had you on here since I think 2017, and that's to my chagrin because last time you were on, we provided some really great resources for folks that fit the picture, exactly what I talked about in the monologue today. And obviously, things have changed, and you probably have a whole bunch of new things that we can talk about. So welcome back to Aging on the Suncoast.
Thanks for having me. Great to be back.
Yeah. So why don't we just start out broadly, just to kind of set the precedent for our audience today of really what a caregiving family looks like in your world.
Yeah. So typically, every week here in Pinellas and in the Pasco County areas, child protective investigators are checking in with families where there might be allegations of abuse and neglect. And a lot of times there's a decision that has to be made where a child has to be removed, and grandparents are being called in a moment of family crisis and being asked to step in, and that could be any time, day or night. And families are stopping whatever they're doing and having to make that tough decision to say, I'm going to commit and step in there. Otherwise, those kids are going to be going into a licensed foster home by the end of that day.
Yeah. You know, I remember really clear the last time that we had talked about this, probably back in 2017, that one of the examples that we used, and I think it was out of New York, but it was a good beta case to kind of change some of the laws in that, is that the police had really no other recourse but to knock on grandmom's door for the two kids. Mm-hmm. And when grandmom opened the door, they basically just put the kids in, didn't give them information, and left. Mm-hmm. And that put that grandparent into a really serious situation, mm-hmm. and especially not knowing anything because she was presented with a challenge that she was not ready for. So, yeah. What types of factors lead to that? You spoke about abuse and neglect. Yeah. But what other factors are out there that really lead to these types of changes?
Yeah, the real drivers for this kind of situation has been substance abuse, mental health, domestic violence, family instability where there's financial crises and parents are on the verge of homelessness. And so it really becomes a driver for abuse or neglect for young children. And typically we're looking at kids 0 to 5 who are at the most risk because they might not have that exposure to the community like school-age children do. And that's where grandparents and other relatives are being called upon pretty regularly to kind of step in. Every state in the country is in a bit of a crisis where there are not enough foster homes, and kids at times are being held in offices or hotels or driving around with a foster care worker waiting for a foster home. And so grandparents and relatives have been asked more and more to step in, and not with a lot of information or resources available to them. And like you said, the child protective investigator drops them off and often doesn't provide much and leaves, and it really puts the burden on the caregiver to try to figure it all out.
Yeah, and I think they augment a system that's probably set up to care for that kid when they get put in that position. I have to imagine, and this is just my personal opinion, that it's better for that person or for that child to be in a home-like setting rather than in a foster care or an institutional type of care setting in that way.
Absolutely. I think kids, and the research will tell you that kids will do much better, they'll have less trauma when they can go to a relative or somebody they know that they've been to their home, they've slept over, they've had dinner, the grandparents know their needs and interests, and and it just makes it so much easier when you're in a family crisis that you're going to somebody that you know and you love than a complete stranger into foster care.
So I'll use myself for an example. Let's just say that I'm an 83-year-old gentleman, I'm widowed, and I have some son who was incarcerated that has a 9-year-old girl. Mm-hmm. And the same situation happened. Mm-hmm. I was approached and I took in my granddaughter. What types of legal aspects really help me or hurt me in these types of situations?
Yeah, the good news there is that there's help available, and both legally in terms of the laws, there's opportunities for grandparents and relatives to apply for temporary legal custody or even something called concurrent custody, where they can basically share custody with the parent in order for them to meet all of the needs that that child has. And so we utilize a few of the local agencies to really step in and provide information, advice, and then even representation. So through agencies like Bay Area Legal Services and Gulf Coast Legal, they have the knowledge and ability to really kind of walk them through that process.
Yeah, they're such good teams that you're working with over there. I mean, they really bring the subject matter expertise. As an area agency on aging, we recognized, like you did a long time ago, that we needed to put our money where our mouth is. We recognized that there were some issues there when it came to relative caregiving and grandparents. We only used the term grandparents raising grandchildren for a while, but obviously it's broader than that. And so we use Older Americans Act money, and we carve out what they call Title 3 EG, which is the National Family Caregiver Support Program, and we purposely give those two legal entities funds so they can assist you with the endeavors that you guys are going to approach. Prevalence. I know you've been in this field a long, long time. We were talking about our longevity in social services and wraparound services. What does it look like on the national, the state, the county picture? What's the prevalence or the incidence of these types of caregiving families?
Yeah, it's growing, as you mentioned earlier, and across the country, I think we're talking about 2.6 million children
Get out of here.
living with relatives. Florida is third in the country in the highest number of children living with relatives. We have close to 170,000 children living with relatives based on details from the Census Bureau, where a relative, when they're filling out that census questionnaire, will say, I'm a grandparent raising a grandchild without a parent in the home. And so we know those statistics are pretty good. In Florida and in the Tampa Bay area, there are over 40,000 children that are living with relatives. And right here in Pinellas County alone, there are over 6,000 grandparents who are in this position raising grandkids.
That floors me. Just 2.6 million caregiving families out there, or children, excuse me, that are affected by that. Where that sounds, that might be a 0.5% on the grand scale of things. It's 2.6 million lives, and the relative caregivers that are caring for that have been altered, changed dramatically. So,
if you think about COVID alone, there was a report that there were 144,000 new orphaned children who lost their primary custodial parent. And so that's a lot of kids that either have to be taken care of by another family member, or our foster care systems around the country.
yeah, that's crazy. Those numbers, I wish they were a lot lower.
Yeah.
But if they weren't, you wouldn't have be doing the cool things that you're doing today and learning and growing. And we're going to talk a lot more about that later. All right, impacts. Certainly there's impacts on the relative caregiver, generally the senior that's taking care of that child. And then certainly there are impacts on the child. Let's talk first about the impacts that you've seen in your work on the grandparent or the relative caregiver.
Sure. So immediately, when a child's being placed, you're having a financial burden, right? There's all the needs of that child that need to be taken care of, and you may be living on a fixed income, or you may have to reduce your work hours in order to take on this new responsibility. So financially, that is a real challenge, a hardship for many families. We also find that the psychological and the emotional impact, because not only are they worried about that child that just got placed with them, they're also worried about that adult parent who's struggling with substance abuse or mental health issues or instability that they're worrying about. And then even grief and loss, because part of the substance abuse epidemic is a lot of overdoses and overdose deaths. And so grandparents are struggling with grief and loss issues. So we have those kinds of issues. And then even their housing is impacted by that, because they might be in a one-bedroom or a smaller place. They might be in a 55-plus community that may provide some challenges for them to take in children long-term. So housing can be a real challenge. And then even their physical well-being, their health and their wellness is going to be impacted by this new stress that they're experiencing.
Yeah, it's funny you brought up housing. I distinctly remember our conversation years ago with the abundance of the 55 and up communities in the state of Florida. There was a lot of rigidity on having somebody that was below 55 staying there, even in this emergency type of situation.
Correct.
And you brought up a good point with the grieving. Certainly that has to be tackled, but you're obviously, or I don't know if, or certainly are you seeing a lot of these relative caregivers not taking care of themselves because now their priority has shifted towards that child?
Yeah, I think all focus tends to just run right into the needs of that child because they come with a number of complexities, academics, their own health, the school issues, mental health problems of the children, and immediately the caregivers, like even for your older caregivers that are caring for an older family member, they have stopped thinking about their own needs. They're prioritizing other things, and so they're not going to primary care visits. They're not doing their follow-ups. They might not be managing their medications. Their sleep is impacted. Their nutrition and physical activity. So we definitely know there's an impact on those caregivers from this new role that they're taking on.
Yeah. So let's start and just talk about as briefly as we can the impacts that you're seeing on the actual children. We talked about the grandparent and the relative caregiver.
Yeah, so again, those kids are struggling with just the trauma that they may have experienced, abuse or neglect. So those psychological challenges that they're experiencing. And then academic issues, right? Kids who have had instability where they're moving around a lot. The parents maybe weren't really engaged with the school, and so they've been wrestling with making sure they're academically on track. And then for those 0 to 5 children, are they developmentally on track, right? Are they socially, emotionally developing? Are they meeting those milestones, and are they ready for elementary school?
Such a important time for development in those years right there. Larry, thanks so much on there. We're gonna come back and talk a little bit more about what the Children's Home Network does in the second half. Please stay with us while we take a short break. As usual, don't forget to have a pen or pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center's helpline and the Children's Home Network.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.
Welcome back to Aging on the Suncoast. During the first half of the show, Larry Cooper helped us understand the reality of grandparents and/or other relatives raising children. Now let's examine the types of services the Children's Home Network can offer to assist these blended families. Larry, welcome back to the second segment of our show today. I think we did a pretty good job illustrating really these types of families and why they come into your life, and some of your staff are working very closely with them. And we also talked about some of the impacts too, to kind of just paint a picture so we know. So let's spend some time talking about your organization, and then also talking about all the different types of resources that you can offer to put these families in a better spot. So, who and what and how did the Children's Home Network all come to be?
So the Children's Home's been around the Tampa Bay area since 1892. So we've been one of the longest standing not-for-profits in the Tampa Bay area.
Amazing, 1892.
Yeah, and it really was one of those old kind of orphanages back at the turn of that century. And over the years have really engaged more in child welfare and kind of the traditional foster care system that we now know. But over the last really 30 years, we've had a real focus in on primary prevention. So really, how do we get to families before kids are removed from their families? How do we support parents and grandparents so they can have their families be successful, so we can keep those kids with their families healthy and safe and growing successfully. So we've provided a number of different services, everything from Healthy Families, which works with children and their parents from birth to 5 years of age, to other in-home services that really support families.
Mitigation efforts, they go a long way. As an employee of the Area Agency on Aging, we do a lot of prevention things as well. Our biggest challenge is the education, getting people to understand what aging aspects look like so they can prepare for them rather than being, for lack of better phrases, smacked in the face with aging reality in a crisis situation. So I'm pretty sure you're faced with a lot of that as well. And just for a reminder, we'll be running a lot of contact information throughout the show, giving you information on how to contact the kinship services through the Children's Home Network on there. So kinship services, as I just mentioned, is your dominant program where you and others are working with these relative caregivers, grandparents raising grandchildren. Let's talk about that. What is kinship services?
Yeah, so for the past 20 years here in the Pinellas Pasco area, we've been providing intensive wraparound services. So going to the home, meeting with those caregivers, understanding what their needs are, and then delivering services and supports that really meet the needs, not just of the children, but of those caregivers themselves. Because as you know, the caregiver population has their own set of needs, and so we try to make sure all of those are taken care of, and then we wrap around a number of other services and community partnerships that we leverage to really meet a wide variety of needs for that family.
Yeah. One of the things that we didn't talk about is where you're located.
Yes, so we're serving Pinellas and Pasco in Hillsborough County. We also, over the years, have expanded into the Central Florida area and into Miami because we know that this is not just a Tampa Bay area issue, but really this is happening all throughout Florida. And so we've taken what we've developed into a very successful model into other parts of the state.
Yeah, and we're going to talk about that model a little later on. I really applaud all your efforts on this. You're a humble guy, Larry. And I know, just because I saw it on TV watching one of the Tampa Bay Lightning games, is that you were elected as an awardee of the Lightning Community Hero Award. You didn't bring that up, but I'm raising it for you. Why did you get that award?
Well, thank you. I appreciate it. 22 years of service, developing and really advocating for grandparents raising grandchildren. It was one of those exciting things, to be able to serve a deserving population of caregivers. When I think of my own parents as grandparents, there's nobody more deserving when grandparents are, stepping in. If it's just as simple as doing a pickup at the school for, after school, or an outing on the weekends. But to think about grandparents stepping in full time, it's easy to be dedicated to helping others, and it was a great award for us and to get recognized to do that. So it was, and the Lightning just did an amazing job, and it's unbelievable how much they recognize a lot of the local folks who have been doing this social service work and making an impact in the community.
That organization is very philanthropic too. It also came with money too, did it not?
Yeah, I brought $50,000 so we could apply that to the program to really add to the work that we're doing, make sure families are getting those needs met. We're heading into the depths of hurricane season, so some of that will land in hurricane preparedness packets for many grandparents, as well as back to school supplies for many of the kids getting ready to head back to school this fall.
Yep. So bravo Tampa Bay Lightning and bravo Children's Home Network.
Thank you.
You mentioned a little bit earlier model, and as long as I've had a working relationship with you as well, you started these programs out really just trying to figure out what the needs are, and then you got so good at it, and you found a system that really worked, and that's what I'm just going to quote unquote call a model. But explain what I mean by model and what that looks like for you.
So over the past 20 years, as we were learning from the caregivers what those needs were and what services best met those needs, we started to work closely with evaluators and researchers from USF and really started to hone in on what's working, what's not working, and so we want to do more of what's doing well. And so what we learned is the impact that we were having was creating better safety for children. It was improving the well-being of the children and the caregivers, and we were creating more stability for those children in the long term. So we were doing research, we were publishing articles demonstrating the effectiveness of the model, and last fall we were recognized nationally as an evidence-based model, meaning that we didn't just come up with something that we think works, we tested it and said that it's actually proven to be successful. So, we really are excited by that recognition, but it just helps validate the work. And I think the other thing that was huge for us is that we have, over the years, hired grandparents and aunts and other relatives to work in the program as regular employees that help inform us and work with others to really make sure we're not missing anything that's vital to caregivers. So they're just a part of the work now, and they do amazing things in the model. And so it allows us to, really show funders that, their dollars are well spent on a model that we expect to really do well for families.
And why not? Why not tap into that expertise? You had a term for it, the living and breathing. I guess that's, you didn't say
the lived experience of caregivers.
Right, yeah. And working with evidence-based programs is no easy task whatsoever. There's a lot of work that goes in there. I know that it wasn't, so kudos to you for doing it. Are you able to replicate this evidence-based model anywhere else?
Yeah, so actually over the last few years we've been working with the state of Delaware. They researched around the country for a model that they could use in their state. They realized that they were not really providing the right supports or the right amount of supports to their families in Delaware, and they said, hey, we've found this model down in the Tampa Bay area, and so now over the last 3 years we've been training their staff in the area and really proving that this model that's worked here can be replicated successfully in other places.
Well, good for the state of Delaware for understanding all the strengths that Florida can bring to the table.
Yeah.
I know that you'll help them out, and I know that they'll have the positive outcomes that you're seeing over here too. So let's get into some of the nitty-gritty of what kinship services actually can provide to relative caregivers. What exactly can you provide?
Right. So typically they're going to get that initial needs assessment by our staff through an intake coordinator or a family support coordinator, and they'll get 3 to 6 months of intensive in-home supports where we're developing a plan of action that's going to really meet their needs, and it's family driven. And as we wrap that around them, we have support groups that are led by other caregivers and invite the caregiver and their children to participate. We bring in experts from around the area to help inform them on different issues. Those are daytime and evening support groups, so we make it available all throughout the Pinellas and Pasco counties.
Can I go into your assessments that you were talking about?
Sure.
Totally doing the intake and the assessment and identifying needs is super critical. We do it, obviously, with the senior population that we're serving as well. One of the things that we find sometimes is that our seniors will paint a rosier picture of what's happening out of certain fears, either fear of institutionalization or that they aren't able to accomplish the goals that the average person could be able to. Right. Do you see that in the population that you serve, that they paint a little bit of a better picture than what you actually can observe?
Yeah, I think most relatives are pretty anxious and scared in their new role. They sometimes even ask our staff, are you here to take the kids from us? And we're absolutely trying to build that trust. So I think when we come with a caregiver, somebody with lived experience walking in the door that's got that lived experience as a caregiver, it alleviates a lot of those fears.
That's really cool.
So I think that, allows us to kind of get into the nitty-gritty, because that caregiver that works on our team will say, hey, this is what I went through. These were the challenges that I experienced. This is the way it impacted my family. And I think that allows for more real conversations about how this family's being impacted, and allows us to kind of dig in deeper into what those needs are from, again, the finances. Nobody wants to talk about their finances or their health and those kind of things, or even, if something were to happen to them as an older person, who would they have step in, and having those kind of tough conversations.
Yeah, what a great way to rapport build, using the persons with lived experience. And I'm sorry to interrupt you on that too. You just got done talking about support groups, and then there's some other things.
Yeah, absolutely. I mean, we've added a new program, a respite care program, which allows caregivers to get a little time off to go to the doctor, visit with friends, do a grocery shopping without the kids in tow, and reduce some of that stress. And I think being able to have some of that in-home respite is critical. We link up with, as I mentioned earlier, the legal services. We connect with counseling services. On our team, we actually have a tutor that can help address some of the academic issues that the family might have for those children. And then we also have a developmental specialist who's going to look at those early childhood issues and provide some modeling and teaching for that grandparent, because they may not be familiar with the latest and greatest on infant and child safety issues, co-sleeping, safe sleep, car seat safety, as we've seen in the news, hot cars here in Florida, those kinds of things, water safety are critical to the safety and well-being of children.
Yep, that maturation process and all that revolves around that. That's important for any newcomer to really know. Yep. And some of our grandparents and relative caregivers probably had some experience, but that experience is a long time ago.
Absolutely.
And things have obviously changed, hopefully for the best on there. September is a big month for you. What do you do in September?
Yeah, so September, every year, the national government had created a holiday called National Grandparents Day. So we take the time to take advantage of that to celebrate our grandparents. So all throughout the Tampa Bay area, we have celebrations and recognition and connect with caregivers to really applaud them for all the sacrifices they're making for kids. So, we really want to take that time to, really let the community know really what's happening here in the Tampa Bay area and what a significant impact those grandparents are having on kids right here.
Sure. In addition to celebration, it's public education as well.
Exactly.
And that helps your cause go a long way. You used to have Rally on Tally as well, if I remember, and some of those grandparents would go up to Tallahassee and talk about their issues and state some of the needs that they have to see if the government can help out there too.
Yeah, so since 2019, with all of those advocacy efforts, we've seen a real increase in the legislature passing some bills that have led to some new efforts, some new financial aid, some new things that allowed for more navigation services to be provided all around the state to make that job easier, to make it a more of a kin-friendly environment to really help help their journey be a little bit easier.
Yeah. Let's talk briefly about legal. You know as well as I know, I can't do it as well. I can't work with our network of partners out there. We talked about Bay Area Legal and Gulf Coast Legal and how they are instrumental in helping your caregivers navigate some legalities, either on the good side or on the bad side. Can you give us 30, 40 seconds of really what that looks like?
Sure, and it's more so than even just the custody that we mentioned earlier, getting some temporary legal custody, getting some legal advice, but they're also dealing with public benefit issues. They're dealing with housing issues. They're dealing with landlord-tenant types of things. So really, Bay Area and Gulf Coast can look at the full array of things that caregivers might be needing in addition to the needs of that specific child. So it allows us to get a good assessment to them, give them information and education, and then if they need an intervention with some representation, those two agencies do a great job to really do the best job they can for them. And they're very knowledgeable about what's happening in the caregiver field as far as grandparents raising grandkids.
Yeah, they're superpowers over there, and I'm glad that they're working with you. Larry, it's so great to have you on the show again, and we hope to see you sooner than later, as I was talking about earlier. We hope you enjoyed this month's broadcast. We also hope this episode offered you valuable information on where to seek help if your family situation is one like we described today. We'll be back next month, and until then, please make every attempt to seek out the resources and services we discussed today.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.